Every clinician complains about documentation. But will AI actually make that problem smaller instead of bigger? Well, here at the Oracle Health Summit, one organization shows how AI has already improved their daily practice. For Billings Clinic, which is spread across Montana and beyond, the stakes are pretty high. Clinicians juggle hundreds of miles of coverage and thousands of patient encounters, and they were looking for technology to cut down note-taking time, possibly in half, because to them, that's the difference between finishing work at midnight or being home for dinner. I sat down with Dr. Randy Thompson. He's the Chief Health Analytics Officer at Billings Clinic, to hear how more than 300 providers at their organization are already using the AI agent from Oracle Health to generate over 100,000 clinical notes. And he's going to tell me what that's meant for their workflow and patients. Let's get to it. Dr. Thompson, welcome to the program.
Well, thank you. I'm excited to be here.
I'm excited to have you talk about some of the interesting things that you've implemented with Oracle EHR. But before we get there, Dr. Thompson, can you tell our audience a little bit about your role and about Billings Clinic?
Sure. I'm Randy Thompson. I'm the Chief Health Analytics Officer for Billings Clinic. Billings Clinic and Logan Health are the largest independent Montana-based healthcare system with the mission of delivering compassionate quality care for all the patients we serve across the entire state of Montana, northern Wyoming, and the western Dakotas. Our system consists of 2 tertiary care referral centers and 23 additional community and critical access hospitals.
You have quite the large geographic area that you're covering.
We do, and if you actually look, if you draw a diagonal line through Montana, it actually runs from Washington, D.C. to Chicago. That's the area that we have to cover. And so it's, geography is a major challenge for us in trying to deliver the same quality care at all of our institutions and then getting them to the appropriate places for their care. That's one of our biggest challenges.
And what type of care do you provide to the community that you serve?
So anywhere from a primary care visit at a critical access hospital 300 miles away from our flagship, the Billings Clinic, all the way to Billings Clinic, which is a level 1 trauma center and acute comprehensive stroke center. So we have different levels of care, and we try to keep the patient as close to home as possible while getting them to the appropriate care facility if they need more comprehensive, complex care.
Now, one of the things I was told is that your clinic is one of the ones that have been using the clinical AI agent for a little while. Is that correct?
That's correct. We were one of the beta testers, and the program has been phenomenal, the response. So we've rolled it out to over 300 of our providers, more than 30 specialties, and we've generated so far, well north of 100,000 clinical notes. And just the feedback has been just remarkable, from a reduction of the documentation burden and a reduction of some of their cognitive burden as well. So it's really been a phenomenal program.
Talk to me a little bit more about that cognitive burden. When you say that, what are some of the things that you were doing before that maybe now are lightened because you have the AI agent?
Yeah, so basically it comes down to the system, the agent, is listening to the conversation and capturing all those details that normally a provider would have to remember, either write down or try to remember and bring that into their notes. So the system, the AI agent, is remembering those details and being able to put them in the notes. So one of our ear, nose, and throat providers commented that before CAA, I had to type, talk, and listen all at the same time and try to remember those details, get them in the note, get my orders done. And now she just lets the AI capture that, and then she goes and completes her notes. So she says at the end of the day, she has more energy and feels less fatigued because she's not thinking about all those details. And our providers feel comfortable to walk away from the encounter, not having to rush through and finish their note to capture all of those details.
And in terms of the benefits, you mentioned a couple there where it's less cognitive load, a bit more efficient. What are some of the other things that you've realized through using the AI agent?
Yeah, I'll give you a good example. So I was out in REI shopping recently, and a family medicine doctor was also out there, and she made eye contact with me and headed my way. And I thought that probably she was going to talk to me about maybe how IT had hurt her this week. But instead, she really relayed the story of how beneficial CAA has been for her. Before CAA, she would really struggle to keep up on her notes. She was a busy clinician, a busy mom, a busy caregiver for her family. And so she never got her notes done before she left. She was documenting late at night on the weekends, was on the delinquent chart list, and just had a really less than optimal work-life balance. So her very first day of using CAA, she was done with all her notes, out of the office at 5:30, and she said that had never happened. So she was contemplating reducing her FTE just due to all the demands, but she said she's no longer contemplating that. She's off the naughty delinquent chart list. She has a better work-life balance, better job satisfaction. So it's really impacted her in a very positive way.
I like that. Not on the delinquent chart list.
Yes, that's important to the org.
Well, and have the patients noticed anything as well? I mean, is this helping that side of it? Are they noticing that maybe the docs are a little bit better in the room, or do they even notice that the ambient listening is there?
They do notice that. We've gotten feedback that, hey, I realize that my doctor is now spending more time talking to me instead of looking at the medical record and typing and working, worrying about the computer. They're focused more on me, and we've had multiple patients comment on that.
In healthcare, we sometimes are a little hesitant to adopt new technology. What was this like? Did you run into any resistance when you deployed the AI agent?
It was a little bit of a mixed bag early on. Some people were still hesitant when they hear the word AI. What's that mean? And especially our patients, because we get consent from our patients to use the app. And if this AI app is going to listen to the conversation, and then they worry about that. But when you phrase it, what it actually does, this AI app is going to listen to our conversation. It's going to help me record the details so that I can make a better note. And it's going to create a draft of that note for me so I can spend more time face to face with you, talking to you. And so when they understand that, we've had very few refusals from the patient side of this, even with complex and sensitive conditions like some of our psychiatric visits. Surprisingly, those patients don't have a lot of concern about that.
Has there been any pleasant surprises that you weren't expecting as a result of implementing this kind of technology?
The ones that we weren't expecting really was the reduction of the cognitive burden. That was the first thing, because before it was all about reducing the documentation burden, which is like the number one frustration of providers is documentation. And our top providers, it's reduced their documentation time by 50 to 60% documented. So the unexpected one, otherwise, we found that some providers say, hey, this wrote a better note than I would have on my own, because it captured more of the details that the patient was relaying to me, and it put more problems on the diagnosis. And so some of our providers have noticed that, the note's a little bit better as well.
Yeah, because the ambient listening, it doesn't forget, right? It captures everything, whereas maybe you might have been just momentarily focused on something they were saying and missed a clue, a hint of something else that happened in that conversation.
Correct.
So when you look beyond what you've implemented, where else are you excited to maybe bring a little more AI into your practice?
So I feel for the first time that the system, the HR, is really finally starting to work for us. Really, that's the theme, my theme for this conference. And I'll give you an example. So with the new EHR, these AI-generated patient summaries and the conversational queries are really revolutionary. So the system, the EHR, goes out and searches through the database, extracts the relevant information, synthesizes that, summarizes it, and presents it to the provider in a very concise, readable format. So the provider can actually focus on the information rather than getting the information. And an example of that is a patient who had coronary artery disease on their problem list. So the problem-based AI-generated summary went out, searched the database, found information from 11 different sources, brought that back, synthesized it, and presented it in a very readable format. And so it's unimaginable the amount of time that a clinician in their busy schedule would be able to do that. So I think that's really revolutionary. It's going to help us focus more on the patient rather than figuring out what's going on with the patient. So.
I like that. I like how you phrase that. It's allowing you to focus instead of getting the information. It's actually doing something with it,
Yes.
and more obviously on the patient. We're obviously here at the Oracle Health Summit. Was there anything you heard or saw here that has you excited for the next 12 months or 18 months?
The list is long. So, the new ambulatory EHR, which we're in the process of beta testing now, the acute EHR, the new patient administration system coupled with the patient portal. Those are just a few of the things that I'm really excited about.
So it sounds like you're pretty happy with your decision to stay and stick with Oracle. Not that you were making a decision, but the fact that you're with Oracle EHR, it sounds like you're pretty positive on that.
Very positive. We're certain that Oracle is the right partner for us moving forward.
And what are you going to take away from, other than the new features and functions I just asked you about? Is there anything you're going to take away from being at the summit this year?
One of the big takeaways is how are we going to put this all together and implement all of these solutions as they come at us? Because we're beta testing, or signed up to beta test 17 solutions right now, and that's only the tip of the iceberg. So how do we incorporate these agents as they come along rapidly so we get the benefit of them? So we're really having to change how we plan for the future, and that's one of the big takeaways, is that we need to stay on top of this and stay current.
And just in general, what message would you like to give to your fellow clinicians, to your fellow hospitalists, in terms of maybe those that maybe are a little hesitant to adopt AI? What message would you tell them?
Well, first of all, ask questions. Because as a provider and you're evaluating new AI solutions, there's a couple of questions you should ask. One, how is this going to help me take better care of my patients? Two, how is this going to help me take better care of me, meaning reducing those non-clinical activities, that non-clinical burden, so I can focus on the clinical ones? So those are a little bit easier to answer. Where providers have a lot of questions are in the next questions, which is, can I trust the solution? And has it been validated? Does it actually do what it says it's supposed to do? So those are a little bit harder questions, and that's where AI governance comes in, and everybody's kind of struggling with AI governance. And so we're spending a lot of time kind of revamping our governance structure. And so the question, or my advice to providers, is to keep asking those questions, kind of challenge the people who are rolling out the solution to answer your question so that you feel like you can trust the solution. But once you trust the solution, just give it a try and compare what was generated to your work process, and make sure that everything is valid. Once you feel more comfortable doing that, then don't be afraid to use the solutions.
I like how you put that, because governance, the fact that you're checking AI, you're not letting it do everything on its own. There's some person there to evaluate the output, double check that output. I think that seems to be the Goldilocks spot, the right spot where that's enough human intervention, and also enough automation to make a difference.
Yeah, I think that's key.
Well, Dr. Thompson, where can people go to learn more about Billings Clinic?
So they can check out our website. We have billingsclinic.com to check out our just general website. And if there are questions, they can always reach out to our IT department, and we'd be happy to connect with them.
Well, Dr. Thompson, thank you so much for being on the program. Really appreciate all the information you shared with us today.
Yeah, thank you. Appreciate it.
We've all heard the bold promises about AI easing clinical documentation. But in this conversation with Dr. Randy Thompson, he showed us how Billings Clinic is proving that it's possible. Hundreds of providers are already using Oracle's clinical AI agent to cut note-taking in half and give patients more face-to-face time. Check out the other interviews we did with Oracle Health's clients here at the Oracle Health Summit. The links are below. And hey, if you enjoyed this interview, please mash that like button and subscribe for more great interviews like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.